This is a 24/7nursetutors.com lecture. 24/7 Nurse Tutors, providing unlimited tutoring.
Welcome, and thank you for joining us. Test Taking Skills and Strategies Workshop.
Hello, I want to welcome you to 24/7nursetutors.com. This is one of the most important lectures you will listen to. This topic is so important to your overall success as a nursing student, graduate nurse, and for passing the NCLEX. This course will help you change the way you answer questions forever. Your grades will change, and most importantly, you're going to pass the NCLEX at the first sitting. Now, we have taught these test-taking strategies around the country, and the NCLEX results have been outstanding. In teaching this course, I meet two types of students: the students who listen, learn, and begin to practice what they have learned, and the student who argues about every new concept and continues to fail. I have two requests, please. Keep an open mind, listen, learn, and practice the new concepts I'm going to teach you. And second, send us an email sharing your experience once you pass the NCLEX. Are you ready to begin? What I'm going to teach you will only work for standardized exams like NCLEX, like HESI, ATI, Saunders, and Kaplan exams. This means that if you created the questions yourself, or somebody who was not trained to write NCLEX-style questions created them, then these strategies probably will not work. Let's discuss the NCLEX-style question. What are the three important parts of the question I want you to know? The scenario, the keywords, and the stem of the question. The scenario. The scenario sets the scene. It tells you what is going on with the client. Read it and read it carefully. And at the end, focus on what the problem is. And we'll talk about this again as we practice. The key words are very important. Remember, on NCLEX, they have removed all the extras. No more names, no ages. They will not even tell you if it's a male or female client. But if the client is pregnant, I guess we can safely assume that she's a female. Now, this means when you see left arm, right leg, I want you to say, why did they give me this information? Because it may be important, but it may not. If they tell you the client is 22 hours post-op, ask yourself again, why did they give me this information? It may be important, and on the other hand, it may not. But we're going to note it because it is a key word. The stem? Well, the stem is your question. Read it again and again. My teacher's voice still rings in my head as she prepared me for the NCLEX tons of years ago. Answer the question, she always said. Answer the question. She would repeat it again and again. When I became a teacher, I knew exactly what she meant. Class, please answer the question in the scenario. Do not assume anything. Do not add anything to the questions. Just answer the question. Don't get caught up in the scenario and forget what the question is really asking. Let's talk about key words because they are very important. Let's look at our client. Most times you will see a client, the client. Anytime you see any word before client, highlight it. So if you see a 45-year-old client, remember now, NCLEX removes what I call excess words, words that don't need to be there. So if you see any word before the word client, guess what? Highlight it. Yes, highlight it. It may be important and it may not be. Now, what if you see a severely depressed client? Could it be significant? Oh, yes. I hope that you're thinking depressed. Is he suicidal? Think safety. I hope you are thinking, depressed. Well, then this is not a client I can teach anything. So if one of your answer choices is teach the client, eliminate it. If you see a postpartum client, which word will you highlight? Yes, postpartum. Any word before the client is probably important. A 3-year-old client, which word would we highlight? Yes, 3-year-old. Why did they tell you it is a pediatric client? Any word before the client, guess what? Highlight it. Now let's talk about absolute words. Can you name some absolute words? All, everyone, always, every, only, never, none. When you see answers containing words like these, eliminate them. Listen to this. 100% of women love music. 100% of men like football. Now, is that true? Well, you know it's not true. Quite a lot of men like football, but not 100%. It is so rare to find anything that is 100% in healthcare. What do you think about this statement? 100% of clients with hyperthyroidism are skinny. True or false? 100%? False. Almost all of them, yes. But 100%? Probably not. Remember, other keywords could include the time frame, age of client, and the priority setting. You know, the other day I brought a student to my office who had been struggling. When it came to understanding patho, he was second to none. When it came to teaching his classmates about a disease process, he was excellent. But somehow he really struggled with exams. Has this ever happened to you? You know your stuff, but somehow it doesn't really show in your exam results. Are you able to explain stuff so well that those you teach make a higher grade than you do? Well, that is all about to change. In this course, I'm going to teach you how to answer NCLEX style questions and get them right 99% of the time, even if you have no idea what the question's about, even if you have no idea what it is talking about. Yes, I know what you are thinking. It sounds like magic. Well, you know, when you get to the NCLEX, you are going to have to guess some of the answers. There's no way you will know 100% of the answers. So we will make sure if you guess right. The nurse is in the room when the physician tells her client he has stage 4 prostate cancer. The client's family returns to the room and he happily tells them the biopsy was negative. What action should the nurse take? A. Talk to the family about the client's need for family support. B. Remind the client that the results were positive. C. Ask the client to restate what the healthcare provider told him. Or D. Encourage the client to talk to the nurse about his fears. Let me give you a second to think about this question. Could he be in a stage of grief? Okay, class, let's talk about answering questions about grief. Now, I love the grief giraffe on YouTube. Watch it and let me know what you think. Grief has various stages: denial, anger, depression, bargaining, and acceptance. We'll discuss this in more detail later on. It goes like this. Let's say you go to visit Grandma because you just heard Grandpa died 2 days ago. And you know Grandpa and Grandma have been married for 70 years. When you go to Mama's house, you meet Grandma sitting at the table for two. Now what do? Do you say, "Hey Grandma, I hate to tell you, but Grandpa died 2 nights ago"? Would you do that to Grandma? Please just leave Grandma alone to make her food and stay with her. Now, if Grandma's making food for Grandpa 3 years down the line, do we have a problem? Yes, we do. Grandma will need help. Here's an important test-taking tip. Do not take away the coping mechanism used in a crisis. I'll repeat that. Do not take away the coping mechanism used in a crisis. Let me give you a second to think about this question. Should you talk to the family about the client's need for their support? That sounds like a HIPAA violation to me. B. Remind the client that the results were positive. Who said the client did not hear the physician? This client appears to be in denial. Should we ask the client to restate what the healthcare provider told him? What would you say? Excuse me, Mr. Smith, can you please repeat exactly what the doc told you? I don't think so. We're looking for trouble now. How about encourage the client to talk to the nurse about his fears? Excellent. Support the grief of denial used as a defense mechanism during a crisis. Obtain more information so you can assist your client to cope with the news. Here is your first test-taking tip. Empower yourself. This is such an important concept. You need to make sure you take care of yourself. What kind of people do I want you avoiding? Yes, avoid negative people. You know who I'm talking about. Those people that say to you, we're not going to make it. We're all going to fail. Did you know everyone in last year's group took the NCLEX 4 times and did not pass? Future nurse, I have a very good piece of advice for you. Run. Yes, run away from negative people. I don't care if it's your best friend. After you pass the NCLEX, you can become best friends again, okay? Now, use words successful people use. Can you name some? I can. I will. I am able to. I will succeed. And keep what kind of attitude? Yes, a positive attitude. Tell yourself, I can do it. I have what it takes to pass this exam. I am more than a conqueror. I will be successful. I want you to say this to yourself every morning. I can do this. I have what it takes to pass this exam. I am more than a conqueror, and I will be successful. In this course, you are going to learn how to identify bonus questions. Yes, NCLEX has bonus questions. Yes, NCLEX does. Now, these are questions I want you to spend 15 to 20 seconds on maximum, so you have more time to spend on the difficult questions. I will say it again. Spend a maximum of 20 seconds on bonus questions so you have time to spend on the difficult questions. In this course, I will teach you how to identify bonus questions. Let's talk about airway, breathing, circulation. Now, I do not need to tell you this one. This is your ABCs. If your client is not breathing, we have a problem. Airway, breathing, circulation will always be your priority. Remember, you are more than a conqueror and you will be successful. Join me as we review core content in the next unit.